Parkinson's disease is a progressive and neurodegenerative disease, the second most common disorder of this type after Alzheimer's disease. It's a condition where small clusters of dopaminergic neurons in the midbrain die. The gradual loss of these neurons results in reduction of a critical neurotransmitter called dopamine. Dopamine is a chemical responsible for transmitting messages to parts of the brain that coordinate muscle movements.
In this image, we can see how a Parkinson's patient has less production of dopamine.
The exact cause of Parkinson's disease is unknown. Most researchers agree that this disease is caused by both genetic and environmental factors, and by interactions among these factors. It is estimated that Parkinson's may have a genetic cause for 5 in every 100 people with the condition. There is some evidence that environmental factors, for example toxins, may cause dopamine-producing neurons to die, leading to the development of Parkinson's. The term environment refers to the world around you and the pathogens, for example viruses and bacteria, toxic chemical and heavy metals that occupy it. It is thought that around 1 in 500 people are affected by Parkinson's disease, and which means there are an estimated 127,000 people in the United Kingdom with this condition.
Common motor symptoms include tremors or shaking in hands, arms, legs, jaw, and face, repetitive actions like typing, rigidity or stiffness of limbs and trunk, slowness of movement, difficulties with balance, speech, and coordination, difficulty doing fine movements like picking things up, morning stiffness. There are also neuromotor symptoms which may develop years before the onset of motor problems. These may include poor sense of smell, constipation, depression, cognitive impairment, and fatigue.
Well, the first stage is early or diagnosis stage, the time when someone is first experiencing symptoms, being diagnosed and then coming to terms with this. Second, maintenance stage, when symptoms are controlled perhaps by medication. And advanced stage, often called the complex phase. And finally, palliative stage, providing relief from the symptoms, stress, and pain of the condition. Parkinson's disease can be cured, but medications can help control your symptoms. In some later cases, surgery may be advised.
Carbidopa-levodopa is the most effective Parkinson's disease medication. It's a natural chemical that passes into your brain and it is converted to dopamine. Amantadine. Doctors may prescribe amantadine alone to provide short-term relief of symptoms of mild, early-stage Parkinson's disease. Anticholinergics. These medications were used for many years to help control the tremor associated with Parkinson's disease. Surgical procedures. Deep brain stimulation. In deep brain stimulation, surgeons implant electrodes into a specific part of your brain.
And I'm gonna talk about what is this. Okay, first we know that this is the most common cause of dementia of old adults, and we have to know that it's a degeneration of the cerebral cortex, and this causes cortical atrophy, and then we can to see less production of acetylcholine. People that is find cause of this don't discover something that can cause Alzheimer. This disease is irreversible, global, or progressive. Now that I'm explaining what Alzheimer is, it's important to know that it is a general idea, and we have to emphasize in symptoms. We have the principal symptoms that can indicate if old people can to have this Alzheimer. It's important to know that we have three kinds of symptoms: earlier symptoms, progressive, and finally later symptoms. The first one is so important for the diagnosis about Alzheimer. I'm going to explain earlier symptoms. These earlier symptoms are the diagnosis. The first one, we have the memory lapses, and the second one is forgetting names of people and places. This talk about a person who is with us, and for example, we are talking with that kind of people, and and that person can to remember our name, or if we go, for example, to a place for that person, and that person can to indicate that place or can name it, okay? And we have to be so careful with these people because they get lost, and sometimes it's really complicated for the family try to start a conversation because they can't to remember some words. At third, we have to the difficulty finding words or things that I said before. Inability to remember recent events. For example, they can't remember what they do yesterday or the next day, and they usually forgot appointments. If we, for example, we have to go to the doctor and they can't to remember that, or they have to take some pills and they can remember that have to take the pills. So it's really important to be so clear with the information that before. I'm not saying that some people that can't remember some things or something about a conversation or some words or the name of places can to have Alzheimer. It's important to go to the doctor and do an evaluation about these earlier symptoms, okay? That's really important, and I think that is a priority for the diagnosis. And then I'm going to explain something about the progressive symptoms. If the person has Alzheimer, has to go to the second stage. If a person has at the first stage with the symptoms that I said, a person necessarily has to pass to this stage, okay? First, we have two difficulties with the language that I said before. They can't find some words that want to explain us. We have problems with decisions because they can be so confused about decisions can to do or can to make, okay? And it's really important if we have a relative or we have a patient with this stage to control it till the third stage that are the later symptoms, and it's a really complicated stage of this disease. Finally, I'm gonna talk about later stage. Okay, the first one of this is disorientation. That this means that they lost sense about where they are. Okay, and then we have apathy. That this means that they lost interest in everything. They don't want to do anything, and they probably can to present psychiatric symptoms and behavioral symptoms too. Okay, at the first place we have depression, we have illusions or delusions. Illusions means that have a distorted sense about reality. Okay, and delusions are, for example, that they are having an unreal situation. I don't know, maybe they are thinking of these people that are thinking that are fighting against Godzilla or against a Power Ranger. It's an unreal situation, okay? Okay? Behavioral problems like first disinhibition. That this means they lost all their sense of shame and keeps doing embarrassing things. And then we have aggression, and they feel agitated too. And finally we have eating alteration because they don't want to eat anything, and incontinence. That was the only and the general explanation about Alzheimer. We have to what Alzheimer is, and we have the symptoms, the earlier symptoms, the progressive and later symptoms, and we have to understand that we have a stage. Please remember that this information is only a help, okay? The doctor has to do a diagnosis. The doctor has the tools for a correct diagnosis, and this is only a help. If you have a relative, or you have a person in your family that probably with the symptoms that I said before has Alzheimer, but please, you have to go to doctor for a correct diagnosis.
Both diseases are neurodegenerative and typically begin in late stage of life. The difference between Parkinson and Alzheimer is that in Parkinson, the neurons that produce dopamine in a brain area called sustancia nigra are affected. The dopamine is important because it's involved in controlling movements and coordination. When the neurons are not working well, affect the motor skills, like tremor, muscular stiffness, slowness of movement, and difficulty doing fine movements like picking things up. In Alzheimer's disease, brain areas are affected, initially hippocampus and entorhinal cortex, which are critical for learning and memory. So Alzheimer's disease is a condition where affects cognitive abilities, like memory, language, orientation planning, and behavioral, like mood and personality of the person. In summary, Parkinson's is a disease that affects the movements, and Alzheimer affects the memory.
Our bodies or something like that. The first idea. The first one is so important because